Welcome to the deep dive. Today we're tackling two really important areas. They might seem separate at first, but there are some fascinating connections.
Right.
We're looking at how families communicate when dealing with Huntington's disease, and also the pressures on healthcare professionals, specifically physiotherapists, that can lead to something called moral distress.
Exactly. And we've gathered quite a bit of research here spanning from, about 2017 right up to 2025. We've got qualitative studies really getting into the family experience with Huntington's, and then these mixed method studies looking at moral distress and burnout in physios.
So our mission today is really to pull out the key insights for you, maybe show some of those unexpected links between these topics, kind of cut through the complexity.
Yeah, give you that comprehensive picture.
Okay, so let's start with the families. Families affected by Huntington's disease.
Ah,
We've got this study. It's really insightful from Golethes, Jensen, and Farragan, published in the Journal of Genetic Counseling back in 2022.
right. And their aim basically was to understand how the kids, the offspring, and their caregivers actually experience talking about HD, throughout childhood and growing up.
And how do they go about that?
Well, it was qualitative. So they did these in-depth, semi-structured interviews. Think of them like guided conversations.
Okay.
They talked to 36 offspring, quite a range, teenagers up to adults in their 60s, and 14 caregivers, all in Norway. Getting both sides is so important here.
Absolutely gives you that richer picture. And what was the main takeaway? What did they find?
Well, the central finding, really, is that talking about HD isn't simple. It's absolutely full of dilemmas.
Dilemmas. Like what?
Like tough choices. When do you even start these conversations? What exactly do you say? How often do you bring it up? And then there's the whole issue of who outside the family do you tell? Or do you tell anyone?
Wow. Okay. So lots of things to navigate.
Definitely. And these dilemmas, they really highlight this basic tension, right? Caregivers want to protect their kids, naturally. But the kids also need to understand what's going on, what the future might hold for them or their parent. The researchers found some really powerful examples of this balancing act.
Okay, let's dig into one of those. You mentioned the timing dilemma.
Yes, they called it too soon or too late, maturity or adaptability, my timing or your timing.
Catchy. What does that mean in practice?
It means caregivers really wrestle with when and how to talk about HD. They're balancing that obligation, to inform about the genetic risk with this deep desire to shield their children from worry.
But what did the children, the offspring, want?
Well, here's the key thing, often a mismatch. The study found offspring generally wanted to know about HD and the genetic risk young. Often, even before symptoms were obvious.
Really? Younger than parents might think.
Often, yes. And when the timing felt off to the children, maybe it was too sudden or too late, it could be really difficult. There was an example of a teenager finding out about his dad's HD sort of spontaneously, unplanned. That wasn't ideal.
Yeah, I can imagine. That really highlights how much the offspring needed these talks to be planned, handled when things felt emotionally stable,
Yeah.
where their needs felt prioritized.
Exactly. And if they didn't get explanations early on, sometimes kids could even start blaming themselves for things they didn't understand.
Oh, wow. That's tough.
It is. And that leads straight into another dilemma they identified. Too much or too little. Honesty or caution. Too often or not enough.
Okay, so the content and frequency of the conversation.
Precisely. The kids in the study, they needed explanations for the changes they were seeing in their parent who had HD. It's confusing otherwise.
That makes total sense. Just watching someone change without understanding why.
Right. And the study points out that not having enough information, that can cause real distress, make it harder to cope, and lead to those inaccurate ideas about it being their fault somehow.
But it's not like they wanted a constant running commentary either.
No, that's the other side of it. Even when they wanted early disclosure, they weren't necessarily sure about getting all the details at once or how often HD should be like a daily topic. It's finding that balance.
Okay. And then the third dilemma was about sharing outside the family.
Yeah. To share or not to share, help or stigma, my choice or your choice. Families really grapple with this. Who else needs to know? Friends, teachers, extended family.
That brings in privacy concerns, worries about stigma.
Definitely. But also the need for support versus the fear of judgment. It's often a very personal, sometimes isolating decision.
And the study connects all these dilemmas back to trust.
Yeah, trust within the family, relationships is key. How much trust there is really impacts how this information is shared and received. It can either strengthen bonds or, sadly, damage them during these really critical conversations.
So if we boil it down, what's the big takeaway from this study?
I think it's the crucial role of healthcare professionals. People like genetic counselors. They can really help families prepare for and navigate these dilemmas, offer guidance, support the offspring's coping.
That's really valuable work. Okay, let's shift gears a bit now. We're moving from the family context to the experiences of healthcare professionals themselves, specifically physiotherapists, and this issue of moral distress.
Right. Moral distress. Maybe we should quickly define that.
Good idea. So moral distress is essentially that emotional, cognitive, physical strain that professionals feel when they know the ethically right thing to do, but they feel blocked from doing it. Maybe by institutional rules, lack of resources, things like that.
Exactly. And we've got a study here from Inbar and colleagues, published in Nursing Ethics in 2024. They looked specifically at moral distress in Israeli physiotherapists.
And they used a mixed methods approach.
They did. So they combined quantitative data numbers from surveys with qualitative data from in-depth interviews. Gives you both breadth and depth.
What were they trying to find out?
Their goal is to understand what contributes to moral distress in physios and also how they cope with it when it happens.
So the survey part first, what did the numbers show?
They surveyed 407 physios. They found, on average, a moderately high level of moral distress.
Moderately high.
And interestingly, it was significantly higher among women and also among pediatric physiotherapists.
Pediatric, working with children. Any idea why?
The study doesn't definitively say why, but you can imagine the ethical complexities and emotional weight involved in treating children, especially those with severe conditions. They also found a positive link with moral sensitivity.
Moral sensitivity. Meaning?
Basically, how attuned someone is to recognizing ethical issues in the first place. So the more ethically sensitive they were, the more likely they were to report moral distress.
Huh. So being more aware of the ethics might actually make you more vulnerable to the distress when you can't act ethically.
That seems to be the implication, yeah. It's a tough spot.
And what are the interviews? You said they talked to 21 physios in more detail.
Right. And this is where it gets really vivid. The interview data brought the numbers to life. People described intense emotions, this real inner conflict between their ideals of care and the constraints they faced, in the system. They also talked about coping strategies like using reflection. But what really struck the researchers was how eager many were to talk about it. Like, these were experiences they'd often kept bottled up.
That suggests it's a really significant, maybe under-discussed issue for them.
I think so.
Did specific things come up as sources of this distress in the interviews?
Yes, two main themes emerged. One was solitude, feeling alone with this burden. The other was witnessing human suffering.
Witnessing suffering, yeah.
They shared a particularly powerful example of a therapist working with a very severely disabled young child. You can just feel the emotional toll that would take and how it could lead to moral distress if they felt they couldn't provide the ideal care or support.
Absolutely. That's incredibly tough.
And what's interesting is how these interviews added layers to the definition of moral distress itself. People talked about negative self-directed emotions, things like shame, or feeling they had to repress their feelings.
So internal feelings, not just frustration with the system.
Right. And also this idea of perceived involvement, wrestling with what they felt they should be doing in these difficult ethical situations, while also trying to manage professional boundaries and what the organization expected or allowed.
It sounds like a complex web of internal feelings and external pressures.
Exactly. The researchers basically concluded that moral distress stems from this growing gap, a gap between the physio's personal morality, their perceived ability to actually act morally in their job, the level of organizational support they get, and just the day-to-day realities of the work.
That provides a really clear picture of moral distress for these physios. Now, there's another study we have that looks at related things: perfectionism, moral injury, and burnout. Still with physiotherapists, but this time in the UK.
Right, this is research by Biggs and colleagues in PLSO1, very recent 2025.
And their focus was connecting these three things: perfectionism, moral injury, burnout.
Yes. They wanted to see how these concepts relate to each other among UK physios working in different settings, the NHS, private practice, sports, and so on. They did an online survey with 402 physios.
Okay, these terms, perfectionism, moral injury, burnout, they sound like they could easily be linked. Can you quickly define them in this context?
Sure. So perfectionism here is about having really high personal standards, being very self-critical. They looked at two types: self-oriented, that internal drive to be flawless,
Okay.
and socially prescribed, that's feeling external pressure from others, maybe colleagues or the system, to be perfect.
Got it. And moral injury, It sounds similar to moral distress, but maybe different.
It's related but distinct. Moral injury is often described as that deeper feeling of betrayal, like your core values about what's right have been violated, perhaps by actions you took or failed to take or witnessed. It can be quite profound.
And burnout.
Burnout, as many people understand it, involves things like emotional exhaustion, physical fatigue, feeling drained, maybe cynical, and a sense of reduced accomplishment in your work.
Right. So how did this study find these three things? Perfectionism, moral injury, burnout were connected for UK physios.
Well, the results were pretty significant. They found strong links between both perfectionism and moral injury with burnout.
Okay, so they're all related.
Yes, but more specifically, they found that socially prescribed perfectionism, that external pressure, was a significant predictor of moral injury.
Ah, so feeling pressured by others makes you more susceptible to feeling morally injured.
That's what the data suggests. And then in turn, moral injury was a significant predictor of burnout.
Wow, so there's a pathway here. External pressure for perfection leads to moral injury, which then leads to burnout.
That's the sequence the study highlights. It's quite concerning. They also noted worryingly high levels of burnout in their sample of UK physios.
High burnout levels are never good news. That potentially impacts patient care, right?
Absolutely. That's a major concern. It paints this picture where this maladaptive perfectionism, especially the kind driven by external expectations, can make physios vulnerable to moral injury when their values clash with reality, and that significantly bumps up the risk of burnout.
So what are the implications then? What needs to happen?
Well, the researchers really stress the need for strategies, probably at a national level, to tackle these risk factors. We need ways to manage perfectionism, prevent moral injury, and support physios who are burning out. They called burnout in healthcare a wicked problem.
Wicked problem, meaning it's complex, interconnected, hard to solve.
Exactly. No easy fixes. It requires systemic thinking.
Okay, so we've looked at family communication in HD and moral distress and burnout in physios. Let's broaden out again slightly and touch on the ethics of genetic testing in neurodegenerative diseases more generally. This brings us back towards the Huntington's context, but also includes others.
Right. And for this, we have a systematic review. This is from Nurmi and colleagues, published in the Scandinavian Journal of Caring Sciences in 2021.
And a systematic review means they gathered and analyzed findings from multiple existing studies.
Precisely. They looked at 24 peer-reviewed articles published between 2009 and 2019. Their specific aim was to describe the ethical implications of genetic testing for these conditions, but crucially from the perspective of at-risk family members.
Ah, so focusing on the family angle again. What main ethical issues did they identify?
They distilled it down to 4 central themes or implications. The first was decision-making as a dilemma.
Sounds familiar, like the communication dilemmas.
Very similar themes, yes. Here, it's the tension between an individual's autonomy, their right to choose, their desire to know their genetic status, and their sense of responsibility towards their family, whose risk status might be revealed indirectly.
And people want testing for different reasons.
Yeah, motivations varied. Reducing uncertainty was big, planning for the future, being able to inform relatives, but it's always a balance.
Okay, what was the second ethical implication?
The individual's right to voluntary and informed decision. This review highlighted that this right isn't always straightforward. It can sometimes be threatened, maybe by pressure from family members, or even unintentionally by healthcare professionals.
How so?
Well, think about the difficult situation where, say, an at-risk parent doesn't want to know their status, but their adult child does want to know theirs, which could inadvertently reveal the parent's status.
Oh, right. That's a real ethical minefield.
It is. And the review noted that violating someone's right not to know could have serious negative consequences: depression, anxiety, even suicide attempts in some reported cases. It really underscores the need for careful, tailored counseling and long-term support.
Absolutely. So, personal autonomy, but also the right not to know. What was the third theme?
This one involved the conflicting emotions after knowing genetic status. It's not always simple relief or simple distress.
What do you mean?
Well, even getting a negative result, learning you don't carry the gene mutation, doesn't always lead to straightforward happiness. Some people feel survivor guilt, especially if other family members tested positive.
Wow, I hadn't considered that. Guilt for getting good news.
Yeah. And there's also the fear of harming other family members just by sharing your own result, positive or negative. It's emotionally complex.
Definitely. Okay, and the fourth implication.
That was privacy and confidentiality.
Right.
Genetic information is obviously highly sensitive. People have a right to decide what they share and with whom.
But it gets complicated in families.
Hugely. There's often confusion about how much should be shared, and there's this ongoing ethical debate. Does familial confidentiality, the family's right to know relevant genetic information, sometimes override individual confidentiality? Plus, the ever-present fear of genetic discrimination and stigma in wider society.
It really sounds like this review highlights just how many layers of ethical complexity there are for families dealing with genetic testing for these diseases.
It does. And they also make a key point. Most of the research they found focused on Huntington's disease.
Right.
There's much less research on the ethical implications from the family perspective for other conditions like, say, familial Alzheimer's disease or frontotemporal dementia. That's a gap.
And they also called for more research on diagnostic testing ethics, not just predictive.
Yes, testing after symptoms appear versus testing before. They concluded by saying we really need to raise awareness of all these ethical issues among everyone involved: researchers, clinicians, counselors, policymakers, the public.
Okay, so we've covered a lot of ground. HD family communication, physio-moral distress, and burnout. Genetic testing ethics. As we bring this all together, what are the connections we're seeing?
Now, one thing that strikes me is how those communication dilemmas in HD families, the emotional burdens, the difficulties in sharing information, they kind of echo aspects of moral distress, don't they?
How so?
That feeling of knowing what you perhaps should do, like be completely open with your child, but feeling constrained, maybe by the desire to protect them or fear of the consequences. It's not the same as professional moral distress, but there's a parallel in that internal conflict, that inability to act perfectly in line with one value without compromising another.
That's a really interesting connection, that tension between conflicting responsibilities.
Exactly. And that seems to be a common thread across all these areas, right? This constant balancing act between individual needs, autonomy, well-being, and then broader family or professional responsibilities and constraints.
Yeah, that definitely comes through.
And in all these situations, whether it's families navigating HD or physios dealing with ethical pressures, the importance of open communication, trust, and good support systems seems absolutely vital.
Crucial for navigating these really complex situations. So for you, the listener, we hope this deep dive has really underlined the complexity here. These aren't simple issues with easy answers.
No, definitely not. And there's always more to learn, more to consider.
We've touched on the really tough communication challenges in HD families.
The significant impact of moral distress, perfectionism, and burnout on physiotherapists.
And those intricate ethical webs surrounding genetic testing for neurodegenerative diseases.
Yeah, a lot to think about.
So here's a final thought for you to ponder. Considering this intricate web we've explored, communication, ethics, personal well-being, how could a deeper understanding of these dynamics actually help us create more supportive environments, both for families facing these genetic conditions and for the healthcare professionals who are under so much pressure? What was your biggest aha moment listening today?
Yeah, something to reflect on. And we definitely encourage you, if any of this sparked your interest, to maybe look up some of the research we mentioned or find resources on Huntington's disease, moral distress, genetic counseling. There's a lot more out there.